Hello, my name is Brad Dato, a student at Boise State University. This presentation is on personal health record options. In this presentation, we'll cover a definition of the PHR, information to include, medical record sources, standalone, tethered, and non-tethered PHRs, paper-based, hybrid, and electronic PHRs, the future and your next steps. According to the American Health Information Management Association and their site myphr.com, the PHR is a tool that you can use to collect, track, and share past and current information about your health or the health of someone in your care. Here's another definition that emphasizes AHIMA's recent push to go electronic. The PHR is an electronic, lifelong resource of health information needed by individuals to make health decisions. Individuals own and manage the information in the PHR, which comes from healthcare providers and each individual. The PHR is maintained in a secure and private environment with the individual determining rights of access. The PHR does not replace the legal record of any provider. You've probably heard the expression, knowledge is power, and that really is the emphasis of the PHR, empowerment over one's health. It can be a quick reference for medical decision making. It provides a consolidated longitudinal view of one's health, and it enhances communication between caregivers and providers. So the scope of content to include in a PHR really depends on what the intent is. Here are some of the categories: personal identification, contacts, illnesses and diseases, surgical procedures, medications, immunizations, allergies and drug reactions, family history of diseases and conditions that are relevant to your conditions, legal documents like wills, directives, power of attorney, diet and exercise, and basically anything that will help caregivers and providers make informed decisions about your health. One of the main reasons why you want to create a PHR is because there are so many different sources, and your job is to pull all of those sources together. If it happened more than 10 years ago, more than likely you'll have to try to remember the best you can. Health records are also available from your providers. Typically, they only keep records for the past 10, maybe 15 years, depending on the provider. And they can provide you with paper copies or electronic files in various formats. And these files can be encrypted and then sent to you electronically or on a disk for you to store on your own computer. Some of the primary health record documents to request are physical exams, lab, path, radiology reports, admissions, and discharge summaries. Before we go into the various PHR options, let's talk about some of the characteristics of PHRs. The standalone PHR model is one that doesn't integrate with any other systems. And the biggest feature is really that the individual controls all of the access and who they share it to. And one of the biggest differentiators between the different options is that they can be paper-based or electronic. Electronic PHRs are often internet-based, and they can be tethered or non-tethered. They're considered tethered when they're connected to an electronic health record system or other database. Also known as portals, they're available from employers, healthcare facilities, and insurance companies. A shining example is My Healthy Vet, which is available through the U.S. Department of Veterans Affairs. A non-tethered ePHR is controlled by the individual, but still the content scope depends on each internet site. The most basic option of a PHR is the paper-based version, or hard copy. It is the easiest to complete, and to get you started you can print and fill out the forms that are available on myphr.com. Later on, those forms can be scanned into an electronic format onto your computer. This really should be the first and the last step. And it's the last step because even if you do have an electronic PHR, that you could actually print it up and use this as a backup hard copy. The advantages of a paper-based PHR are that they're really easy to use, you have control over access, and there's no need for a computer. The disadvantages are that it's harder to find information, it's inconvenient to transport, and you may be overwhelmed quickly with paper, folders, and binders. The hybrid PHR is kind of a stepping stone from paper to an electronic format and includes paper and electronic files. However, it might be inevitable if your provider prefers to supply electronic files, and you always want a hard copy backup just in case. The advantage of a hybrid PHR is that you can ease into the electronic version as time and comfort level increases. The disadvantage is that you might have dual maintenance of two different formats, and it would be difficult to find information in two different locations. The first type of electronic personal health record is on a standalone computer. That's going to require a personal computer system with software for word processing, spreadsheets, and graphics, as well as a printer, scanner, or all-in-one device for input and output to the computer. The author will need computer skills and a list of the health information requirements needed to enter into the programs. The advantage is that it's easy to append the information on the computer, easy to share, and secure if the user takes the right precautions. The disadvantage, which is a big one, is that it's a huge ongoing responsibility for the author to create, maintain, and then secure that information. The other type of electronic PHR is on the internet. In this type of version, the information is typed into a predefined form. It's easy to update the information, and you can actually copy and paste the data from the computer to the internet site. These sites can be tethered or non-tethered, and they can actually be a source for your own PHR. Again, the advantage is easy to use and update. The data structure is already in place, so you just type or copy and paste. The disadvantage is that security, privacy, and control shifts over to the site host. These hosts are not regulated by HIPAA unless they are a health facility. They also might lack adequate technical support for users. As you can see, there are a lot of internet sites that have electronic PHR. Here's a list that is taken from myphr.com. Here are a few mobile apps that are available. These links are also available on myphr.com. The future is definitely with electronic PHRs, but before there is more widespread adoption, people will need to feel more secure with technology. There are numerous private and public organizations and associations that are dedicated to expanding PHR features and options. Electronic health record system standards will drive system interoperability and eventually enable real-time communication between patients, providers, government agencies, insurance companies, and other health data users. The states are currently creating their own health information exchanges, which will eventually roll up to a nationwide system. The ultimate PHR dream would be to provide everyone the ability to view their family's complete horizontal medical record via a secure internet site. Until a complete and functional health information exchange is in place, the onus is on individuals to create their own PHRs. Start by visiting myphr.com to learn more. Print up the forms and write down all of the information that will enable your providers to make informed health decisions. After it's on paper, you can slowly start transferring the data to a computer or internet site. Computers are really the ideal tool to enter, organize, update, and then share your PHR with others. You can use a personal storage device, encrypted email, or the internet. If you have any questions, consult a registered health information technician. A RIT certified professional has been thoroughly trained on the intricacies and processes involved with medical records. They understand the importance of security, privacy, and access to your protected health information. Remember, when it comes to your health, knowledge is power. Thank you for listening.